This is LiveWell Talk on New Clinician Spotlight. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Today's episode is another installment in a series on the podcast where we sit down with new clinicians at UnityPoint Health, Cedar Rapids, and get to know them as a clinician and as a person. Our guest on today's episode is Dr. Stephen Brown, a physician with Physicians Clinic of Iowa Orthopedics. Dr. Brown, welcome to the podcast.
Thank you. I appreciate it, Dr. Arnold.
First thing the listeners want to know, no relation to Charlie Brown?
None.
Okay, all right. Well, glad we cleared that up.
I wish I was, though.
Yeah.
We have royalties.
Yes. Tell us a little bit about yourself. Where are you from? Family? Tell us brief.
Yeah. So I'm 42, married, 3 kids. Grew up partially half my life in upstate New York, the Rochester area. My parents got divorced when I was younger, and I went with my dad, and so we relocated to Missouri. So I kind of consider myself a Midwest sort of guy. That's where a lot of my mannerisms and things, came from. Went to middle school, high school there. After that, went to Arkansas, a small college, Christian university called Harding University. Went there on a football scholarship. Through there, obviously going to a smaller Division II school, knew that football was coming to an end, and so really tried to do well in academics. Never really even wanted to be a physician. Didn't know much about being a physician. No one even graduated high school in my family, so this was all new to me. I had some just great mentors though, including specifically one of my trainers, and then organic chemistry teacher named Dr. Stewart, who really pushed me to excel and take the medical entrance exam. Did well there, and then ended up went up to NICOM, which is a osteopathic school in Long Island. Went there, finished up my training, and decided that I want to do orthopedics. And from there, went out to Southern California at Riverside University Medical Center. And so made the trip from East Coast to West Coast to finish up my orthopedic training. From there, did my training and really enjoyed orthopedics, but just felt like I needed to do a little bit more. Especially I really enjoyed surgery, but I also enjoyed clinic. And orthopedics, a lot of it is very operative heavy. And then I went to my pediatric rotation, and that was really attractive, to me. And so just a different diagnosing and treatment option. So then finished up in Southern California and went to Ohio State for my pediatric fellowship, where I continue. We got a lot of trauma and residency, very trauma heavy. And then even in fellowship, continued doing a lot of trauma with the trauma place across town. And then from there, the last 10 years, just been doing trauma, and then just all my electives is pediatrics. And so ended up coming to Cedar Rapids, Iowa.
Well, we're excited. We're at Missouri. Did you go to high school?
Where Springfield is located.
Yeah.
So we're about an hour and a half east of Springfield, little town, 10,000, called West Plains, Missouri.
Yeah.
Yeah,
in Southern Missouri, they don't put a lot into names. Like it's like Mexico, Missouri, Texas, Missouri. They
West Plains, it's very basic.
Yeah, they're just like, hey, we're not going to put a lot of effort.
Yeah, I think that's just.
Your training in fellowship, so it was in pediatrics?
Yep, it was pediatrics.
Okay,
yep.
Cool. Yep. And what was the biggest thing you learned out of that?
I think the biggest thing in pediatrics, I mean, it was all new, because even though we ran a pediatric clinic, and then I even went to my rotations, every surgery is different. So you learn all these adult surgeries, but there's for example, the femur, there's 6 different ways to do a femur fracture based off of age and skeletal age and the sex of the patient. So just learning all the different surgeries. And I think the one thing is learning how to come up with vocabulary to not only explain it to the parents, but also to the kids. And so learning how my attendings talk to the kids and explain things in such a manner that was inviting to the kids, not intimidating to them, but also in a way that the parents could see that you were able to bond with that child and gain the trust of them.
Yeah, that is rewarding. And I'm internal medicine trained, and so but I'm not afraid to see kids. I've filled in the urgent care, et cetera, and it's the nice thing about kids is they get better.
They do,
and that's just heartwarming on a lot of levels, and they're so innocent and just a lot of fun. I could see why people enjoy doing pediatrics.
Yeah, I just think it's like it's such a pure field.
Yeah.
I mean,
Yeah.
they have no alternative motives.
No.
They want to get better.
Yeah.
I mean, they want to, and that's why they do get better. I mean, you're not worried. You're not dealing with any, narcotic stuff. You're not dealing with, workman's comp. It's all these kids want to get better. The worst thing is a school no.
Yeah.
Most time it's me convincing them that they need to slow down.
Yeah.
Versus the opposite. And the kids, it's never necessarily their fault. They're normally put in those circumstances, whether it's just a simple, they're at the gym or they're in a car wreck. It's never really their fault. It's a very pure field.
Yeah, I'm sure you'll get in as you get established here in the community, some team physician work, and that's hard, like with the high school athletes, because the season's so short.
Mm-hmm.
If you say, well, take 6 weeks to heal, well, that's the season, and so I totally know what you mean. There's always a pressure to say, slow down. I remember when my daughter, they'd tell her to rest it, and she'd say, okay, so you mean I can still like do deep squats? No, we mean rest it. Okay, so I'll ride the bike then.
Yep.
No, they just said rest it. You just hit the constant battle.
Yeah, so to that, learning how to, and you have these conversations with parents all the time. It's just like, what does rest mean? What to you? How do we get there? And there's some kids like, I put them on a cast. They don't need the cast to heal.
Right.
They get a cast to slow them down.
Yeah.
Because these kids are too
that's
active.
So true.
So just managing the treatment and expectation for these families is it's a very interesting, rewarding part of my field.
Now, what other clinical interests do you have? You soft tissue disease, I think you mentioned to our pathology colleagues that you're interested in that. Tell me about that.
Yeah, so specifically what we're talking about pathology was about is anytime you open up an adolescent pediatrics or orthopedic practice, you're a generalist at the end of the day. And so that's nice, but it also will lead to specifically some typically benign bone tumors. And so, but mixed in with those benign bone tumors, you do your best ability with history, physical exam, trying to identify the malignant tumors, but you'll get some that slide in, and we need to make sure that we can, if we biopsy those, what are we going to do with those, and what happens to those patients when they have an unfortunate sort of diagnosis. But clinically from the peds, more community peds stuff, clubfoot is a big one. There's always a community, need for that. Hip dysplasia, certain hand deformities such as syndactyly, polydactyly, some basic scoliosis, spine deformities. That's all kind of in the general pediatric world.
Oh, cool. How'd you find Cedar Rapids?
Yeah, so I had been...
other than you probably heard about this podcast.
Well, I did, actually.
Okay.
Yeah, Dr. Arnold, you're actually pretty famous. We had met once before at a conference.
Yeah.
I know so I actually sat on a couple committees as well, and I think we ran across each other at one point. But I didn't know much about Cedar Rapids, to be honest with you. Our hospital went through some changes, okay? And then so my wife and I had spent the last 9 months looking for just different options, seeing what was out there. Wearing sort of two, different hats as the adult trauma side of things, and then the pediatric side of things. Those jobs are few and far between. I think when you find a match, it's a really healthy, a really good match. But if you are strictly peds, they want you just to work in a pediatric hospital, and that's all they want you to do. So I'd be giving up my adult training, something that I think brings me a lot of happiness and joy, versus, or if you go to the adult side, you'd obviously be giving up all the peds. So not every hospital's like St. Luke's can handle both. And those that even want to, sometimes they don't have all that infrastructure. So as I was looking for potentially a new position or staying in Tulsa, believe it or not, a rep from one of the companies I use is good friends with the group from PCI, and so had reached out to me and set me up with Dr. White to have phone conversation. It sounded good, and then we didn't really talk for just a couple months, and then we had kind of regrouped, and so I decided to come out here and just tell my wife, I was like, listen, I'll just know when I know. And I'll tell you, when I first got Cedar Rapids, driving around, I hadn't even visited the hospitals yet, drove in here and loved the community. It just was exactly what we were sort of looking for aesthetically. And then it just became more and more promising as I met the group at PCI And then I found out what they were looking for. They really needed somebody
that's a good
with my
fit for you.
skill set.
Yeah,
It was a good fit.
absolutely.
And then I was really excited when I came over to, St. Luke's, and Mary, had, introduced me. You guys have the whole women and ped side over there.
Yep.
Met some of like the pediatricians, and right away they're like, wow, we really need something like that. Talking to your ER doctors, maybe some of the trauma that is leaving could stay here if there's someone who had that clinic interest. And it just so happened that, hey, that's actually what I'd like to do. And that's your guys' needs.
Well, those pediatric elbow fractures, the guys are like, man, I haven't done one in a couple of years or never since I've been in practice. And, you don't want someone practicing on a kid, right? With growth plates and all that. And so that'll be nice. We talk in other podcasts, and you'll hear me talk at other times that, you know what you do, how you do it, but what's your why? Why do you do it? And I think that's important. People will, when they find their why, that's where the happiness comes in, the satisfaction with their, whether it's medical practice or being a truck driver, etc. What's your why? Why do you get up every day and do this?
Yeah, for me, I think because there's certainly a need, and I like to feel that and know that you're making a difference in these, kids and even, the adults, lives. And so being able to come in and provide some care that maybe they would have to go somewhere else or just couldn't get in general, it happens more often, I think, than providers realize, especially in the adolescent peds where it's like, hey, we don't have the money to travel 2 states over, 2 plane tickets, et cetera. If you don't do this, surgery, then our child's going to be stuck with this. So, there's just, it's such a good feeling to help people.
What is the most important message you want to get out there about your practice and as you get started? You're certainly approachable. That's been really apparent, but how would you like to describe your practice and what patients should expect?
Yeah, I think, number one thing is, I'm a pretty conservative surgeon, and especially with like the adolescent and peds. So I end up, it takes me a little bit longer, and I like to develop the relationship, with the family and the parents before we go down a surgical sort of, road. But I think the main thing is like you mentioned, like I do feel like I'm approachable, and being the family history I have and how I grew up, like I feel like I still relate very, very well to my patients. And I've never lost touch of that. Years later, I still feel like I do a really good job with getting to know my patients, and
good for you.
They have a very good like understanding of who I am.
Yeah, I think that skill is not teachable, to be approachable, and the ones that have it, it's people are grateful that you have that skill, and you should cherish that.
I appreciate that,
because it's like you said, it's not something you can teach. It's hard to learn, but when people have it, it's just a pleasure to be around them and pleasure to have them on the medical staff. How does someone get in to see you?
Yeah. Easy phone call to the PCI, front desk or referral.
Take new patients.
Center. Yeah.
Okay, awesome. Well, some fun questions here. What do you do in your free time?
So
when you have free time.
Yeah, so what is it? What is free time? So the things that I enjoy most is probably fishing and hunting. We got some land in northwest Oklahoma, deciding right now currently what we're going to do with that, because it is a little bit of a drive getting down there. But we do a lot of turkey hunting, duck hunting, whitetail, a lot of bass fishing, trout fishing when I get to like Arkansas.
Yeah, and northern Arkansas, southern Missouri has a lot of that, doesn't
it?
Yeah.
A ton of it. The rivers there are amazing. And so that's what I enjoy doing.
Oh, good for you. Well, Dr. Brown, thank you again for joining me. It was fun to get to know you, and we're glad you're here with PCI and with St. Luke's and joining the medical staff.
Yeah.
Once again, this was Dr. Stephen Brown, a new physician with Physicians Clinic of Iowa Orthopedics. If you're interested in scheduling an appointment, Dr. Brown, call PCI Orthopedics at 319-398-1545, 319-398-1545. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.